just coming on as a breast cancer survivor. I'm 39 now. I was diagnosed with stage 3, right hormone receptor positive, HER2 negative breast cancer. I had bilateral mastectomies, chemo with 4 drugs that I can't remember right now because chemo brain.
Is real.
25 cycles of radiation therapy, and I'm on hormone suppression for the next 10 years with letrozole and Zoladex, waiting on a PET scan next week. Hi, and happy to be here and be a part of this conversation.
Welcome. Thank you for coming.
Yes.
Jocelyn, if you want to do a short introduction.
Oh, sorry. Hold on.
No
I'm
problem.
in the backyard. My dog is going nuts right now. Sorry.
No problem.
So I'm new to this group. I just joined 2 days ago. I just found out I was BRCA2 positive about a week or 2 ago. So I'm just taking in all the information. Live in New York. Have 2 little girls. That's why I'm outside hiding from them. And happy to hear what you guys have to share.
Perfect. Well, thank you so much for joining. I'm actually Tracy Mogren-Posner. I'm the founder of BRCA Strong. We're here to empower, support, educate, and inspire survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. During COVID-19, we're sending out packages to put smiles on our ladies' face that are facing surgeries, that are starting therapy. So if there's anybody that you know we can support, please reach out to them. You can send me an email or reach out to Kate, and we'd be more than happy to have a package sent out to them. Jocelyn, I know you spoke to Kate today. I will be in touch with you, and if there's any way that I can help you and support you, you can feel free to reach out to me at any time. At this time, I want to thank Christine for coming on and sharing and giving us time to educate us on immune support, why supplements, gut health, which is so important for all of us that we kind of don't realize plays a big role in our everyday lives. And I know I'm excited to hear this topic as something I fight on a daily basis, is weight gain, going through hysterectomy, so I'm very interested and excited personally myself. I know as other women are on the call. So what I'd like to do is pass the mic over to you. And again, thank you so much for your time and coming on.
Yes. Hi. Thank you guys so much for having me. Can you hear me okay?
Yes.
I never know with.
Oh.
There you go. So I put together a little presentation, but I will first introduce myself. I'm Christine Harms. I am a doctor of nursing practice. I've been a nurse for 20 plus years and reached the top of my degree and treat patients now to the highest level. And so I work in cardiology. A lot of you guys with cancer diagnosis and going through different chemotherapies, they probably tell you some of those are cardiotoxic, and I see patients with cancer, and it's an unfortunate process of what you guys have to go through. So being a at risk or someone currently going through treatment or a survivor, gut health and immunity is such a huge part of now your life, and actually all of your family's lives. So I'm excited to share a little bit about what I know and take in all the questions. So I kind of want to make this interactive. If you have a question, you could do a little reaction and raise your hand or put a question on the side, and we'll try to get to all of those, okay? I'm going to share my screen so I could just stay on track here. All right, so today, gut health, the immune system, and then some supplements that you can do and things that you can do at home. So this is me. I think I kind of just went over that. I have lots of years in nursing and a doctor of nursing working in cardiology, but I have a huge, huge passion for functional medicine. I think that as providers, and we do a disservice to explaining some of the basics of life, and what can keep your immune system strong. We've learned and focused our careers on treating symptoms and going through intense therapies, but we forget sometimes the basics. So I hope to get some of that across to you guys today in this topic. And so we'll just begin here. So, health begins in your gut. And I think, I don't know, and you guys could raise your hands, how many of you guys understand and know what gut health really is? Yeah, a few of you, right? So there's so much science and research going on around our guts, our small intestine and large intestine, our balance of bacteria in our system, and how that affects our overall health. And so you can, I'm not a huge fan of Google, you know, patients come in and say, I Googled it. It's not my favorite thing, but you really can. You can say gut health and you will find, you know, evidence-based studies focusing on that particular topic. So just a little background, you know, we have a huge ecosystem of microorganisms in our body. Actually trillions of different bacteria. We have 10 times more bacteria, microorganisms than we do human cells. So when we talk about your immune system and why is balancing your good and bad bacteria important, it's because more of your body is made up of that than our human cells. In your gut itself, we have somewhere around 1,000 microorganisms between parasites and yeast and bacteria. And we need a balance of good and bad. So finding that homeostasis, how do we balance those out? I want to just talk about the word gut health. You know, a lot of people I talk to will say, I don't have GI issues. I'm not nauseous. I'm not constipated. I don't have diarrhea. I don't get those things. As we get into this, you'll realize that it actually manifests as many, many other issues. You don't have to have GI per se symptoms to have a gut health imbalance. And that's what the takeaway is. You know, 70% of our immune system comes from our gut, our balancing of those microorganisms. That's a huge thing when we're talking about how do we keep your immune system strong, particularly you guys in this group. You know, some of you are going through chemo right now. You know, you have to have a strong immune system to survive how toxic that is, right? The secondary infections that you're going to be faced with. So building up your immunity, I can't stress it enough, is part of your journey. And if you're not being taught that, hopefully today you'll take something away. 95 or 90% of your serotonin, your mood hormone, comes from your gut. So lots of things happen because of those microorganisms and how we balance them. So how does it affect how does your gut affect your immunity? And so a lot of it is going to be really basic, but sometimes we need to get back to the basics to understand where our shortfalls are. Lifestyle, you know, poor diet, alcohol, tobacco, environmental factors, stress, you know, our diet in general, we talk about that a lot, and people, I mean, this is not a new topic for any of us, but sugar actually is not great for us. You know, diet sodas, the aspartame actually causes inflammation. So looking at what you're eating, are you eating enough fiber? Are you having healthy fats, not fast foods? Are you eating enough greens, reducing your sugar intake? And if I can stress one thing about diet is, you know, artificial sweeteners actually are bad. We had a whole period in our life, most of you probably remember that low fat diet, you know, like low fat, everything low fat, everything low fat. Well, what they did was load that with sugar, and sugar actually is inflammatory and your body feeds off of that. And if you have any sort of candida or yeast in there, think of it like baking bread. Give me more sugar and I get more inflamed or more candida. And it's a spiral, right? It just cycles out of control. So watching your diet. Medications actually cause inflammation. They weaken your immune system. I don't say you shouldn't have them, but if we can flip this and prevent you from needing them, or as many of them, that would be important, right? Antacids, NSAIDs, you know, Advil, Tylenol, at a chronic state, you're needing it every single day. Antibiotics, you know, a lot of you guys will need antibiotics through your treatment, and antibiotics cause things like C. diff, right? They all come with a positive and a negative effect. So if you have a stronger immunity, maybe you can alleviate that negative. Stress. Stress alters the nervous system in our gut, and all of us are under stress right now. Look at the world. Look at what's happening. So doing things like meditation, taking time to go out for a walk, whatever you can do to try to relieve stress, but that will cause a weaker immunity. And then different infections, right? Intestinal overgrowth in your small intestines, or bacterial overgrowth, parasites. And a lot of these things you wouldn't know just by, without getting tested, an in-depth test. There are tests that you can do for this. But the bottom line is more than 40 different diseases have been linked right now to bacterial imbalances in our system. And so things like arthritis or joint pain, obesity, anxiety and depression, different autoimmune disorders, cancers, Crohn's, IBS, the list kind of goes on. And so when I say to you, you don't have to have GI issues. If you told me you had anxiety, I personally, as a functional medicine specialist, would say, what does your gut look like? Let's see, do you have an imbalance? Because anxiety is directly linked to an imbalance in good and bad bacteria. Why can I not lose weight? The same thing. And so, trying to get to the root cause is so important, and it's sometimes so overlooked. All of those things that I talked about is coined leaky gut. If you've heard of that. Intestinal permeability, meaning that your intestines, that lining actually develops little crevices and holes, and it cannot absorb the right nutrients. Toxins get in, you get GI inflammation, which causes food intolerances and autoimmune disorders. You weaken your immune system because you have this inflammatory process going on. So aside from that, there are things that we can do, at home on our own. And again, back to the basics, getting enough sleep. How many of you guys actually sleep well? Sleep, we overlook it because we think we're supposed to work all these hours and be busy professionals or moms or whatever you do in your life, go for your treatments, run here, run there, but you overlook the fact that sleep actually helps your body heal. It reduces inflammation, helps you absorb nutrients better. Our foods, unfortunately today, even if you ate all organic, our soil is not as nutrient rich. They don't make things with the highest quality ingredients anymore. So we can get a lot of it by changing our lifestyle. But unfortunately, even if you bought the best of the best food, you would need a whole lot of it to equate to maybe some supplements that can help balance that out. And so, so we talked about sleeping, right? 7 to 8 hours of sleep a night. I mean, it supports cellular repair. Anyone going through any sort of treatment or even post-treatment, people are on hormone suppression therapy after you have a cancer. I mean, you need to keep your cells strong. So cell rejuvenation, that happens while you're sleeping. Avoiding alcohol and high sugar foods. I mean, sugar, I'll be honest, even with my patients, I'm a realist. I want you to take away that you have to enjoy life. Going on a crash diet, avoiding all sugar forever, it's not realistic. So take a look at what you're doing in your lifestyle and what small changes can you make that can equate to a big change over time. So if you like cake, don't do it 5 nights a week, do it 1 night a week, pizza, same thing, alcohol, because we all like to maybe have a drink with our family. But if you do anything like that in excess, you're going to cause your body more inflammation, a weaker immune system, the inability to absorb nutrients and treatment, therapies that you're under. And sometimes it translates to a really negative outcome. And so sleeping, avoiding alcohol, and making small changes over time. Prebiotics and probiotics. I'm a huge fan of supplements, and I never was, I never knew what was good, to be honest. You go to the store, there's 9 million different things you can buy. You try to buy the cheap ones, but then are they the best? And then you're convinced that the most expensive ones are actually better when they're really not. So you can do some of that with food. I put some things here, you know, prebiotics come in apples and oats and bananas and legumes. Fiber, think fiber when you think prebiotics. Probiotics add good bacteria to your system. And a lot of people have been told that, oh, well, if I'm on an antibiotic, it kills all the bacteria. That is true, but you need to add in that good bacteria while you're under treatments that wreak havoc on your system. So prebiotics are like Miracle-Gro for probiotics. They feed the good bacteria and help those good ones flourish, balancing out your system. Vitamins and minerals, you know, if you have leaky gut, right? If you don't get great absorption through that intestinal tract, you are not absorbing those minerals that we really need. So you need things like omega-3 fatty acids, vitamin C, vitamin B, vitamin D, zinc. Now, I don't say you need every single one of these, and a lot of times you can find combinations. What I want you to know is that with supplements, even though they are not prescription, some of them are fat soluble, and you have to be cautious of how much you take. So I don't want you to go out and buy vitamin A and think you can just take extra, more is better, because you can actually make yourself toxic. So you want to make sure that you're doing things responsibly with someone that can help guide you. But supplementing is a huge part of your journey here with cancer or post-cancer, or maybe avoiding cancer. So, you know, a brand that I support and I am a brand ambassador for is a company called Plexus. And I've chosen this line because it's easily accessible to a lot of people, and their beliefs and approach resonate with my way of practicing medicine. And so it's a gut health company. They actually were founded as a breast health company, which I loved because, you know, their focus was on overall wellness. And so when I got into this, it was for my own personal health journey: inflammation, autoimmune disease, anxiety, lack of sleep. You know, and I didn't realize how much that meant to me. And that's really what started the journey on functional medicine. And so, you know, they are on the cutting edge of supplements. They treat gut health for adults and children. They use the highest quality ingredients. I like their ethics. Everything is backed by science. It's cost effective, and it is accessible to just the average person. You don't need a prescription for it. There are prescription supplements out there. But again, do we really know how they're made? A lot of it becomes a business, right? So I happen to support this brand. I would love to share more with you guys on that if you're interested. But I hope that my message of sleep, reducing sugar, reducing alcohol intake, supporting your immune system, listening to your body other than just having gut issues, and knowing that that can translate to an imbalance in your system. I hope that you guys got that message. I want to keep this kind of short for you so we have time for questions. I'm going to turn it over to my friend, Carrie Willett, who some of you saw just a minute ago. Carrie is a breast cancer survivor herself. She will tell her story and her journey with how changing her gut health and making her immune system stronger helped her along some of the complications. I'm going to stop my screen sharing here. Let's see. There we go. Carrie, do you hear me?
I do. Okay. Did anyone have questions for Christine before I start? Anyone? All right. My name is Carrie Willett, like I said earlier, and I'm coming to you from Moorhead, Minnesota. So if you hear that accent, you know where it's coming from. I was diagnosed with breast cancer in January of 2016, and it was triple positive breast cancer. My diagnosis came 2 years after I lost my mom to ovarian cancer at age 59, and I did all the genetic testing, and I was certain that, you know, I would be BRCA positive, just with my mom, and then her ovarian cancer, my breast cancer. And it was negative, and I was actually kind of disappointed. I was hoping to find like that link between me and mom, because we were the only ones in our family so far that had cancer. So I feel like someday my connection with my mom's cancer will be found. But I'm just excited to meet all of you. So it's a special community, being survivors. So in 2016, I did my treatment. I did chemo first. I did TCHP, and then I did double mastectomy with reconstruction. I had tissue expanders put in, and then I did 25 rounds of radiation, and then I did Herceptin for a year as well. And then I was just kind of sick of appointments, and I took a year off, and then I got my implants in, did my exchange surgery with fat grafting and implants, and then have had a few surgeries since, just to clean up damage and scar tissue and all that stuff. So that's my cancer story, which it just seems to evolve forever. But Christine was talking, you know, I have always taken probiotics and a multivitamin like my whole life. But I did switch to Plexus supplements in 2017. A friend actually reached out to me when I was going through treatment, and I was like, what are you doing? Like crazy supplements? And, you know, I had no idea what it was when I was going through treatment, and had I known, I would have found some relief with stuff I was going through. But since changing up, you know, supplements that I take, because I used to buy anything, Walgreens, Target, whatever was cheapest, what I had a coupon for, medical grade, came out of refrigerator, like I've tried it all. But since focusing on gut health, like that's been a lot, because, you know, with treatment, with all the medication that we go through, I gained so much weight from like steroids and foods I ate. Like I just ate whatever tasted good, and it was all carbs, and, you know, I'm preaching to the choir. But when I started focusing on my gut health and just starting the cleanup process 3 years ago, I had seasonal allergies. So I had medication for that. I got rid of that. I used to live on Diet Coke and Diet Mountain Dew. I don't even have a taste for that. So I got rid of that. Always made a coffee run in the morning. I always got, you know, a latte full of sugar. Cravings, like I was someone who always had to run to the vending machine in the afternoon in the office because I needed that Diet Coke. I needed a bag of M&Ms, you know, something to carry me through. And I got rid of that. I was also someone, my digestion was so bad. I was like, my whole life I was always backed up. It's not glamorous to talk about, but I had a bowel movement like 2 to 3 times a week, and I was miserable. Like, I know so many people can relate. Nobody wants to talk about it, but I mean, my stomach looked like I was 6 months pregnant all the time. And now I'm just a good regular girl, and it is so nice. I also had heartburn forever. I was taking 2 Prilosec a day, and that's gone. And then also anxiety. I was diagnosed with anxiety when my mom was diagnosed with her cancer, and for obvious reasons, that was just a lot. And then going through mine. So I thought I'd be on anxiety meds forever, because that's just life. I mean, life is stressful. And it is now 2 years that I've been off of all my anxiety meds, and I give all credit to cleaning up my gut and just being healthy. And like Christine said, you have to live. I am not perfect. I like pizza, I like burgers, I'll have a drink here and there, but you know what? Life is short, and I'm not gonna have these huge restrictions. Another thing too is just like the inflammation. Pictures of me previously, like I was so puffy, and like you don't realize how much inflammation that you have on the inside of your body. I've had 4 surgeries in the last 3 years, and just after dealing with inflammation in my body too, you know, coming out of surgery, that first time you have to get out of bed and like stand up, you feel like a truck hits you, and just not feeling that too, just knowing, you know, you see the stuff on the outside that, you know, the inflammation's gone, but then realizing that, you know, a lot of the inflammation on your insides, your ankles aren't swollen all the time, your fingers aren't swollen, can't get your rings off. I had sepsis last year. I had some cleanup on my cancerous side. I had a implant replaced and some scar tissue removed, and I picked up a lovely super bug in the hospital, and I was hospitalized with sepsis, and I was on IV antibiotics for 3 weeks. And just looking back at pictures then, I couldn't believe how, much we really swell up from medication. And like, just, I'm thankful I had 2 years of like working on the cleanup in my system, because those are heavy hitter antibiotics, and I'm glad I had that in my toolbox. And then, just looking at my notes here, I didn't want to miss anything. Something too that I didn't know. So being thrown into medically induced menopause at age 37, not glamorous. It's not glamorous anytime. Like the body aches, the hot flashes, just sitting there, and all of a sudden you're just pouring sweat, it's dripping down your back. I had heard Plexus had a multivitamin that also helped with hot flashes, and the ingredient in there is grapeseed extract. So I was like, oh, okay, I'm going to try this multivitamin. And I can tell you, 3 years now, I haven't had a hot flash. I get warm flushes here and there, but I don't have the drippy sweats, nothing. So that has been a godsend, because so many people deal with hot flashes. I mean, we don't ask for any of this, and it just sucks when you're like, boom, thrown into it. So that has been just a savior. And yeah, I really just close it. I mean, I used to have a list, when you go to the doctor, they print out your list of medications. I had a list, like a full sheet of paper this long, and it was all my medications. And right now I just have one. I did get my ovaries out last fall, so I could stop the Zoladex shots. But I'm on exemestane, just the other, to keep the estrogen sources shut down. So like letrozole, but that's my only medication now. And I was on a lot of medications. So it's been great just to clean stuff up, and it feels good to feel good, because we know what it feels like to feel our worst. And, life is short, and I just want to feel good for it. So thanks for listening to my story.
Thank you so much for sharing. I really appreciate you coming in and sharing your journey.
Oh, yes.
We all have different paths and different journeys, but hearing some of the struggles, that some of us can relate to, and see somebody on the flip side saying, this is what's helped me, or it's nice to hear the positive result.
And the thing is that we all have our own journeys. So I always say, like, what works for one person may not work for another, but there are some commonalities in there, right? And so you just have to find your own path and what actually helps and supports you. But building up your immune system and trying to do the best you can with your lifestyle is such a critical point for all of us. I mean, even if we're not sick, it just translates down the line, right? We all wind up with something along the way. You hit 40 and it's like life's changing. I want to just share my screen one more time, because I have my contact information on here. And so I want to, if anybody has any interest in anything that we talked about, if you need to talk more about gut health, I'm trying to find it. Sorry, share screen.
Hey, can I just share one thing I totally forgot to say?
Yes.
So we were talking about immunity. With that, I have 2 kids, a 9-year-old, 11-year-old. Just with getting healthy, cleaning things up, to the amount of sickness in this household is really non-existent. Everyone knows if you have kids, they're bringing home germs, and now it's even more crazy. Like, yeah, we still get runny noses, a cough here and there, but nobody is sick like they used to. Not like, one kid is sick this week and then the next one, and then we get it, and then it's a month-long deal. So cleaning that up, not having the cravings for all the bad stuff. I'm thankful more than ever now, with all this stuff going on, that it's just an extra layer of protection there.
For sure. Thank you.
Does anybody have questions? And if they do, they just want to raise their hand.
Yeah.
hold on, let's see. Toby, unmute yourself. I can't unmute you.
Toby does.
Toby.
Hi, everybody. Carrie, I have a question. You said that in your household, you know, that your children are rarely sick. Are they on any of these supplements?
So are Nicole.
They are. They are.
Oh.
So, yeah, Nicole knows. Plexus does have a kid's chewable vitamin, which also has a probiotic in it. So my little guy takes that. And then my daughter, who's 11, she, like the multivitamin, the probiotic, she was struggling with bladder infections all the time. So I upped her probiotic, and she's been bladder infection free since last December. But yeah, my kids are on that, and then my husband too. So
just out
they
of
take all
curiosity.
that.
Wait, I have one more question, Tracy.
Go ahead.
Okay. When you were on chemo and then you did your bout of radiation, were you on probiotics pre all that? Pre your,
Yeah,
or you
I
said you were?
was. Yeah, I bought, whatever I had, whatever was on sale at Target. If I happened to be by the health food store, I'd go there, get something out of the refrigerator. So I could probably about 15 years I've been on probiotics, and I thought they were working. But the other thing too is the magnesium with, that's what gets you to go to the bathroom, which that was a missing link in my life too. Just, take probiotics and you think it's going to like fix everything. But a lot of people need that magnesium, especially, with surgeries and stuff, when you're giving all the pain medication, and then they want to send you home with stool softeners and all that fun stuff. And same with kids too. Everyone just wants to put their kids on Miralax, and that stuff is toxic. But yeah, there's simple fixes, and it's not shared enough.
So they have a product, I'll speak about it a little bit because I know a little bit, and then I'll probably pass over to Christine or Nicole. They have a product called Slim that's a drink. I had it. I actually tried Plexus. I love it. Right now, I'm not taking it every day due to some complications that I'm having on another level. So I have to be careful of like what I put until I get official clearance from people. But the pink Slim drink was amazing. My 11-year-old loved it. Like we were arguing over the bag.
And the best thing about that is now we have a kids one. So it's a kids mega kids microbiome, which is what the Slim was that you were taking, Slim microbiome. So now we have one that has a kids, which has some ingredients in it that you get from breast milk.
My question is, and I don't know if you can help or somebody else can jump in or not, but is in the kids version, is there any soy or lavender in that product?
No. So we don't make anything. So let me flip on this. This topic wasn't about Plexus, but it is a brand that I actually really love. So I could speak very well to that brand. I'd be happy. You guys can go out and shop around, of course, but the hard part about being in the community and buying supplements is no one knows anything about them. And when I'm sharing something or I'm prescribing to a patient, the most important thing for me is that I know what I'm giving them. And so I know what's in this. There's no soy, non-GMO, 100% vegetarian, and a lot of times vegan if they can do that. We use no fillers, no dyes, no artificial flavors. And so when you buy a vitamin that's, a gummy, 90% of that is artificial dyes, dye number 90. It's, the capsules that are crushed. Well, they're in a tablet form because they're added with fillers in it. And, so we get this whole premise that a multivitamin doesn't work. Well, it doesn't work because it's just not good quality. And so you have to find someone that knows what they're talking about when you do that. And unfortunately, when you go to your doctor, it's hard. We can't be experts at everything. So you're going to go to your oncologist and they're not going to know 100%. They're going to say, go take Centrum Silver, which is great, but that's a big business that just pushes out vitamins. and look for the efficacy. You know, that's what I would say. If you're going to buy something, look for the research on it, or on the ingredients they use. You know, what do they put in it? All of the stuff through this company that I promote is, you know, they create their products here in the US. They are based on science. You know, we take clinical data, and that is how we formulate them. So never any soy. I am an anti-soy person. Just
Perfect.
yeah.
Does anybody else have any other questions? Go ahead, Aaliyah.
Got to unmute myself. Okay, so I just wanted to kind of jump in and add my little 2 cents, and I only have 2 now.
But
So
she's
when
You could get 3.
oh, well, thank you. So right now, as you all know, I said earlier that I'm going through treatment, and when I remember before I started treatment, I was speaking to my doctor about taking supplements because I would do the woman's once a day vitamin. I'm getting better at swallowing pills now because I really have no choice with all these meds that they give us. But, you know, prior to me going on this journey, I would do the gummy stuff or the liquid type stuff because I did have like a pill phobia, so to speak, or I opened the capsule. So I remember I was having a conversation with my oncologist, and in the beginning, he said to me that he did not want me to take any supplements because of it perhaps affecting the chemo, right? And so I started to do my own research, and like you said before, Dr. Harms, that
Christine, you know, I'm very into that name, and it's not a very good one to be a Dr. Harms, so I just say Christine.
Yeah, I'm looking like Harm. Ooh, okay. But you know, when he was telling me, you know, not to take that, and I thought to myself, with all of his accomplishments and his medical knowledge, right, he may not know everything, like he may not be the expertise. I'm an advocate for my health as well, and I do my own research, and I got with the integrative medicine doctor,
Yes.
who does practice, you know, from the holistic and natural side of things. And that doctor happens to work with my breast surgeon and is on the same team and works for the same cancer institute with my oncologist. And so I went to him, and he pulled my blood. He had me do blood, you know, lab work.
Mm-hmm.
And from my lab work, he saw that my vitamin D was low, my iron was low. And then I started thinking with my logical mind, well, if I'm taking chemo and it's already going to be killing off a lot of my good cells and basically tearing my system down, I do have to build it up. I need to build it up. And so I took in everything that I had at home as far as the supplements I was taking. Yeah, I was taking some gummy stuff because it's sweet and it's good. And
they taste good.
they taste so good. So I took that in to him. Of course, he said, get rid of the gummies. But he also told me to, exactly what Christine is saying, my gut health. He talked about the microbiome. And,
yes.
and what he explained to me is that if I get my gut health and my belly right, then the cells that are fighting in there, they can go up and fight the breast side of things.
Correct.
In my breast, and everything just started registering. But then I was like, well, why my oncologist doesn't have this information? And so, you know, we're not all experts in every area, but I did take that information back to my oncologist, and my oncologist agreed. He agreed. And not only did my integrative medicine doctor tell me these things, he also sent me literature. He emailed me literature for me to read it for myself and for me to understand about the gut microbiome and then your breast health and how everything works together. So I just wanted to share that. So right now I am taking, he wanted me to take a B complex because of the Taxol chemo breaking down certain things. And he said he wanted me to have the B6, the B12 and all the other good stuff. And so, yeah, so I'm doing a little bit of both. And then, of course, the mental side of things, you know, having a support group. So everything works together. And like you were saying with the stress, so meditating. Yeah. So all that does help our gut health. And I just thought I'd throw my 3 cents in. But that part.
I love that.
Yeah.
And
so
you know, I
you,
mean,
Christine.
Yes, I work with a lot of doctors that don't have any understanding of this and actually, quite frankly, don't even care. And that's kind of sad. It's not because they don't. Their focus is cardiology. They don't want to really worry about all the other things. And so they tiptoe around the conversation. So I commend you for going out and seeking some research on your own, because we are our own advocates. Like I tell all of my patients, I could help you in a certain way, but you have to advocate for yourself, because not everyone knows everything, and maybe they're not 100%. And so, you know, they're knocking your immune system down, and his primary goal for you is to kill that cancer. Mm-hmm. And so all the other things are just so complicated, and even though it seems simple to us. So good for you. Very good. Very, very good.
Does anybody else have any?
I'm going to share my screen just so you could have my contact information, because any one of you could reach out to me. I'm going to give you my phone number, my email, my Instagram. I'd be happy to do a free 15-minute consult or talk, or I say 15 minutes, I'm a talker, you know, but just talk to you about whatever your health concerns are. Maybe I can guide you a little bit in one direction or another. I am board certified in Florida and in Colorado as far as a nurse practitioner goes, but just honestly, simple advice. I don't need to be certified. I can talk to anyone anywhere. So let me just pop that up so you can take a quick picture of it if you're interested. And then we can close it up there. That's me.
Perfect. Well, I want to thank you very much for coming on, Christine. And if anybody has any questions for me, Nicole can also help you if you guys have any questions on plexus, and I'm sure Carrie can as well.
Absolutely. You will have access to all of us. So however, if you reach out to me and have specifics that I'm not sure of, Carrie would be happy to answer on a cancer related issue as well, and Nicole. So we have a big team of supporters here. So